Today we're going to go over cervical spine somatic dysfunction diagnosis. We're starting with looking for C2 to C7 spinal processes. Different from lumbar and thoracic somatic diagnosis. For cervical spine, rather than using transverse processes for diagnosis, instead we use articular pillar for cervical somatic diagnosis. After palpating each cervical spine, I found that C3 has the most asymmetry on freedom of motion. C3 has more freedom of motion when side bending to the left and restricted motion on the right. The lack of right bending motion doesn't seem to improve when in flexion. But when I put C3 in extension, the lack of motion does improve, which gives the diagnosis of C3 extended, rotate to the left, and side bend to the left. For atlantoaxial joint, the patient has restricted motion when rotated to the right. And since AA is a rotation-based joint, the diagnosis for atlantoaxial joints is AA rotated left. When diagnosing for atlanto-occipital joint, it is a lot harder to translate from right to left, which gives the atlanto-occipital joint diagnosis of OA rotated to the left and side bended to the right.